Chiquita Brooks-Lasure, administrator of the Centers for Medicare and Medicaid Services, joins us this morning. You just heard the report that Bertha provided. I don't know if you have any context or thing you want to add to it, but I do think there is this question really underlying what you were just suggesting, which is the incentives here and what do you think ultimately happens? There's a lot of good that comes out of it in the short term, but what are the impacts in the long term?
I did hear the report, and let me just start by saying thank you for having me. This is a historic day that we are so excited about, that thanks to the President Biden, Vice President Harris, that for the first time, Medicare is able to negotiate the price of drugs. And I just want to say how important this is, how life-changing this has been to the millions of seniors that I have been talking to over the last 2 years, how much relief there is in this country that the president and the vice president have taken on drug pricing. There are people across this country who are choosing between living and dying, whether or not to put food on the table, whether or not to see their grandkids. And I think it's really important as we talk about all of these issues about what prices are going to be like, what innovation is going to happen, that we really keep at the core of that this country is full of drug companies that are making the most innovative drugs. But if people don't have access to them, it doesn't matter. And what we did in negotiation, what we did in the overall law, is make it more possible for people to be able to get access to, we started with these 10 drugs, but even more than that, this out-of-pocket cap, it is a game changer for our economy, for not just for the seniors and the people who depend on this program, but for their children, for my children and our future children. So I just want to make sure we don't lose track of that.
No, and as you say, it's a life or death issue if you can afford these medicines, but it's also a life or death issue if they will exist in the future. And companies from Roche to Bristol Myers to others are saying this will disincentivize the development. It's billions of dollars, high stakes development for things, especially for rare diseases and cancer. And yes, rare diseases are exempted, but they might not be if they have other uses. And then therefore that disincentivizes their development. Are you sure that this is going to make sure that cures like cancer, which is he keeps saying this is the most important objective for him, that this incentivizes those cures to continue to be developed and available in the marketplace?
There are so many factors that go into a drug company's decision. And I have worked in the industry, I understand, and we have thought about that when we talked with the companies and worked on negotiation. We all are committed to making sure that drug companies will continue to want to innovate. It is crucial that we have a strong market, and we included that in our process. That was baked into the law to include things like research and development costs, to include things like how much does it cost. We thought about things like, are you saving money to the Medicare program overall? So I don't want to leave the impression that by allowing Medicare to negotiate, just like everybody else does, just like your employer insurance does, just like the VA does, that we are not going to allow innovation to continue. It absolutely will continue.
Administrator, I want to pick up on that point in terms of others negotiating. There are concerns from people that the law doesn't really address what the pharmacy benefit managers, what the plans do in terms of their negotiations. And even if you have these prices, that might not necessarily be the preferred drug. There are some people who are concerned that you still might have these drugs on a different tier. What sort of moves are you going to make sure that patients get this price and that they are actually paying their copays based on this price in the plans?
Certainly, this is an issue that we are we are monitoring very closely. And I would say a couple of things. The law clearly outlines that PBMs and health plans that provide coverage for these drugs need to put them on the formulary. We will be monitoring and making sure that plans are not playing games with the drugs that we have negotiated prices for. We take very seriously both parts of it. Getting a deal for Medicare, getting a good deal for the Medicare beneficiaries, but also making sure they get access, because as we are talking about, making sure that there is access, it's important. It's important to the people. It's also important to the drug companies.